Can severe gynecomastia be treated without large scars on the chest? Doctor, I have gynecomastia, I want to get it better, but I'm worried that it will look bad because of the scars. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore, and today let us talk about how severe gynecomastia can still be able to be treated without making it look bad from the scars. Now, firstly, what is severe gynecomastia? There are basically 4 grades of gynecomastia. In grade 1, it is mild. There is just a little bit of glandular tissue, usually just behind the nipple. In grade 2, it is moderate but without too much extra skin. So it's a little bit bigger, but there isn't too much extra skin. Grade 3 is moderate but with extra skin. This is when there is more gynecomastia, but there's also a lot of skin that goes along with it. And grade 4 is severe, where it almost looks like a female breast and there is a lot of extra skin. In addition to this, I would say there is one more grade which is not mentioned in the classical staging, and that is gynecomastia with severe weight loss. So a lot of people, they have a lot of weight loss, they have lost a lot of weight, but the gynecomastia is still there and the skin is very loose and saggy. So these are the different grades of gynecomastia. Now, what is the big deal about skin? Why are we talking about skin? Well, in gynecomastia, we are pretty much trying to remove the fat and the gland that is underneath the skin. And if we try to remove skin, that means we're removing skin, we're stitching it, and we're giving a large mark, a large cut. This is what that would look like. And traditionally, this is the treatment that is usually required in grade 4 severe gynecomastia, sometimes also in grade 3, and also in gynecomastia after weight loss. Now, as you can see from the image, these scars are quite big and quite noticeable. And it kind of defeats the purpose of a gynecomastia surgery. Men are undergoing the surgery so that they can go out freely, bare-chested, going to the swimming pool, going to temples where you have to remove your shirt. And when you have such large scars, obviously that purpose is not served. People will be like, hey, what happened to your chest? Why is there such a large mark? And this was the dilemma that a lot of people felt, that yes, they're getting rid of the gynecomastia, the chest is becoming flatter, but you're trading that for a very large noticeable scar. So what is the solution for this? Well, we at Venkat Center try to do this a little bit differently. We try our very best to avoid giving a large scar on the chest. How do we do this? Well, in the first surgery, we do not remove any skin at all. We make one small hole near the nipple, one more small hole near the armpit. Both of these are very tiny. Through these small holes, we use our skin tightening treatment, also known as InMode, body tight. So this machine uses radio frequency energy. There is a probe that goes under the skin and it heats the skin from the undersurface, and this stimulates the skin to shrink and tighten. So in the first surgery, through these same holes, we use this machine. We use a specialized dressing technique to lift up the skin. With this treatment, we are able to avoid any kind of skin removal and have very nice skin contraction and very nice results in almost 90% of patients, such as this one. So here you see, it's a very large gynecomastia and it has been treated without removing any skin. There are no large visible marks. Now doctor, you said 90%. What about the other 10%? Well, as I said, this treatment works very well in 90% of patients where we are able to avoid giving any large visible marks. In the other 10%, the skin does shrink, but it might not shrink completely and there might still be a little bit of extra skin left. These patients include those who smoke a lot, because the skin doesn't contract very well. Those who have had a lot of weight loss, as I said, because the skin is stretched out and compact, it has lost its contracting power. And in some others as well. So in general, 10% of patients of this group, the skin does not contract completely. So what do we do for them? After 3 months, we wait for the entire skin contraction to happen, and after 3 months, if required at that point of time, we remove a little bit of skin. Now, you might ask, so you still end up removing skin, so what's the point of doing it like this in 2 stages instead of 1 surgery? Well, there are 2 answers to this. Firstly, like I said, in 90% of patients, we are able to avoid giving that scar. Secondly, in the 10% also, we're able to give a smaller scar than what we would have done otherwise. As you saw in the image, that large horizontal scar across the chest, we can avoid that and maybe just give a small scar around the nipple, which is much less visible. And there's a third category of patients who live with a little bit of skin. They're like, doctor, my purpose is served, there's a little bit of extra skin, I don't care about it, I'm going to leave it alone. So these are the advantages of doing it in 2 stages like this. So if you have severe gynecomastia, It can be treated without scars in a majority of cases, and also we do it under local anesthetic. We only give anesthesia here, we do not make you unconscious. And this makes the surgery very, very safe. There are no risks of general anesthesia. Secondly, I can make you stand up in the middle of the surgery, see how it's looking, make you lie down, do some more. So the result can also be better. Thirdly, your recovery is very, very fast. There is no admission, there is no empty stomach. You walk into the OR, you walk out of the OR, you're back on your feet immediately, and you can be back to work within a couple of days. Now let us look at some other examples of severe gynecomastia that we have treated by this method without giving large scars. I hope this solves a lot of your doubts. We have plenty of other videos on gynecomastia treatment that you can also see. If you have any questions, do get in touch with us. Do like, share and subscribe. Thank you. Have a great day.